Hello and welcome to 72 Dragons. Today, we had the pleasure of speaking with Maribet Rivera-Brute. Welcome to this interview, Maribet. It is an honor and a pleasure to have you with us today.
Awesome. Thank you so much. And it's a pleasure for me to speak with all of you.
Great. Maribet Rivera-Brute is an experienced public health professional with a background in various sectors of the public health industry. She possesses a wealth of expertise in areas such as program coordination, nutrition, translation, social media, and more, making her a multifaceted asset to any organization or project. She is currently working as a governance and strategic program coordinator at the Federation of American Societies for Experimental Biology, FASEB. Her previous roles include outreach and partnership analyst, program coordinator, and prereq nutritionist. Also, her involvement with the Latino Caucus for Public Health underlines her dedication to supporting the Latino community public health needs. My name is Dr. Pietro Aparicio from 72 Dragons. Thank you for joining us and for sharing your experiences with us today. Without any further ado, let's begin. Maribet, can you tell us about your background and how you became interested in the field of public health? And can you share some of the highlights of your work trajectory, such as program coordinator at the University of Maryland, IQ Solutions, nutrition programs you implemented in Baltimore, and as a nutrition coordinator at Cedars-Sinai?
Sure. So I became interested in public health. It was, I'm one of the few members in my family with public health. I think it's only one cousin of myself. I coming from a low-income background in Puerto Rico, and I was able to see like what was going on with the healthcare system, and then how can people prevent those conditions, especially obesity and diabetes in Puerto Rico. So that became interested. Then I'm like, well, let's just see how public health will fit for me. And it actually fit perfectly because I'm a people person. And so I studied first with epidemiology, and then I was like, well, I need to add something else because I don't see myself talking to the computers all the time. So I then added nutrition. And I'm like, oh, well, this nutrition epidemiology fits very well just because you get the insight of what's going on behind the screen of different health conditions, of course, tied in with nutrition, and my training is in chronic diseases such as diabetes education. So I started off working with the Latino community in San Bernardino County and Riverside counties in Southern California. And that opened a whole lot other spectrum. I'm like, oh, this is fun. I know I can do this. With that led me then to start it off as a program coordinator with Cedars-Sinai Medical Center back in 2007. And I'm like, well, I haven't done this before. They were looking for a nutrition coordinator. I'm like, I only had a few months of experience, maybe a year of experience in the diabetes education with Loma Linda University School of Public Health and School of Medicine. I'm like, well, maybe I can just give it a try. I'm a person who takes risks, by the way. So then I started off on that one as a nutrition coordinator with Cedars-Sinai. And that work, I did it for 4 years. I was able to create a whole new program. They didn't have this. Is one for their medical mobile unit. And then I'm like, well, this is great because many of the Latino communities, they don't have the access to health education.
A very rich trajectory you have. Now, as a governance and strategic program coordinator at the Federation of American Societies for Experimental Biology, can you elaborate on some of the key responsibilities you have in this role? Also, could you share some challenges you have faced and how you overcame them?
So my history with FASEB, it started off when I was in grad school and I had to participate in one of the experimental biologies. So as you know, FASEB is a federation of different scientific societies. So I had the opportunity to share this diabetes education research study that when I did in grad school in Loma Linda. And I was like, wow, this is great to have this many societies for the passion of science and research. And then when I finished working with the Combat COVID with IQ Solutions in 2022, I was like, I need something that I can just identify myself, that I like to work with. So I saw this position in FAST and I'm like, well, what I mean, this is the people that actually sponsor or were part of the organizers for the experimental biology meeting. And I'm like, I can do this. I want to be part of this. So I work with many scientists, hundreds of scientists that come together either for board meeting or for science policy committee meetings, Capitol Hill Day. Well, those are the highlights events that FASET posts. And I pretty much help my director, my supervisor, who's the director of governance, manage the database, communicating with them, organizing these meetings. And I haven't done this job in the past, to be honest. I was like, I've never worked in governance before. What is it like? And I always seen being part of the APHA member and part of the Latino Caucus member, I'm like, I see one side of the coin. Maybe I can just do the other side of the coin and just be behind the scenes and see what does it look like when you have an association or society. And it's fascinating, let me tell you, because you work with many volunteers that are very passionate for research, very passionate for science. And yes, it has to do a lot with public health too. Many of these scientists, they also have their MPH or their DRPH. And you can see them like, we need to do something in terms of advocacy for science.
Amazing. Now, talking about digital health, which you have experience too, you have worked in social media campaigns, event promotions, digital marketing, and more. How do you monitor and measure the impact of digital outreach and marketing efforts to ensure the success of your campaigns? And can you share a specific effort in the digital health world?
Sure. When I was working with the University of Maryland Extension in Baltimore City as a coordinator, we wanted to do something innovative at the same time because it hit COVID and we were all virtual and we had participants and we wanted to have them engaged. So I spoke with my team, like, what about if we do a social media campaign? And they were looking at me like, well, we haven't done this, one. Two, we have to be very careful because it's a federal funded program. And what are your plans? I'm like, well, we can create different topics. We can monitor in terms of clicks, in terms of engagement of the post, and perhaps we can include that during our classes. So I was in charge of the classes in Spanish in the Latino community in Baltimore City. And I remember sharing this case was Facebook. So I was sharing with them, hey, we have a Facebook page. These are the different posts that we published that is related to our lessons, because we have the program was in series and we have to include different things to have them engaged. So during the pandemic, having them online, keeping people sometimes is kind of a challenge to be engaged in the lessons. We direct them to a different platforms during the class. Or even they were like, I can see them when they were our classes, and then they're like, well, we have in Facebook, look for this post, it's related to the class for today. And they were like, oh, this is great, well, we can see more about this. And many parents, they were expressing to me like, did you post this topic in Facebook? I want to share it, I want to learn more about it. And it actually reached to outside of the US. We have the family members who were participants of the program. In this case was the FNET program. And they were like, well, I shared this with my family in Mexico. I shared this with a family in Peru. And it makes me such a joy because you can see that the efforts were reaching out more people outside of your targeted audience.
Yeah, obviously you like to take on new challenges. Very impressive work. You also mentioned the Latino Caucus for Public Health. You have been a volunteer for the Latino Caucus for Public Health, specifically working with the communications and policy advocacy committees. Can you share some of the key initiatives or projects you have been involved in, and how these committees contribute to the broader goals of the Latino Caucus for Public Health?
Sure. So I remember being started off a member of the Latino Caucus back in 2000, I don't know, 10 maybe. And that time was when Dr. Francisco Tomei, we call it Paco Tomei, they started sharing jobs and different information pertinent to public health in the Latino community. And I'm like, well, this is very interesting because I was part already of APHA. And when I learned that there is a Latino caucus that is passionate for the Latino community, I'm like, I need to be here, because I'm a person who's really into the information and access that is fair to the Latino community. I'm like, these guys, they are really into it. So when I started off with that, and then I met Danny and Andrea Jacobo. I'm like, oh, wait a minute, these guys have a lot of campings going on. And that I started to work with the communications team. And how I ended up in the communications team, I don't remember. I know they were looking for volunteers. So I'm like, okay, well, I can do this. I worked with health communications before when I was in IQ and the Combat COVID campaign. And what little time that I spent there, I can perhaps put it into practice here.
It sounds like a great match with you and the Latino Caucus for Public Health. Now you're doing a very interesting and exciting work. Can you share with us about any ongoing or future projects or initiatives you are excited about?
So I'm currently volunteer of the Johns Hopkins Centro Sol. That's part of the Johns Hopkins University here in Baltimore City. And I am just pretty much a nutritionist volunteer. I am part of the Active and Healthy Families program, which is a program that was based in Northern California. And this work with Johns Hopkins Centro Sol is with the Latino community. And pretty much I provide guidance to the team of what is a very easy way of Latinos to understand what we want to deliver. So if you want, everybody thinks like, well, health education is something that anybody can do. Not exactly. You have to pretty much pay attention to how literate is the community and how you will deliver that message. And this is the purpose here of this program. We want to make it easy for them to follow, easy for them to teach to their families, and easy for them just to stay making those changes. In this case, with nutrition education. And I can tell you, I received many feedbacks from the staff of Centro Sol, like Monica Herrera, she's the director of executive director for the Centro Sol. And she has told me, Maribet, these people are very appreciative of the work that we do. And they need to continue. We need to continue providing this project, with this work with them, because if we don't do it, who's going to do it? Who's going to be the person delivering these simple messages for them that will ensure, at least, don't guarantee, because nothing in life is guaranteed, but at least it will give this small step for them to make change and stick with them. And that way we can prevent any other chronic diseases.
That sounds wonderful. Maribet, has been great chatting with you. Thank you so much for sharing your valuable insights into your professional journey and your contributions to the field of public health. You are truly an inspiration to many. Thank you very much.
Thank you so much for the invitation. I really appreciate it.